To the selfgrowth.com show. My name is David Riklan, and I'm the founder of selfgrowth.com. Today's show is about hypnosis. Our topic is officially the myth and the magic of hypnosis. And for people who don't know a lot about hypnosis, it's been used to effectively treat weight loss, smoking cessation, addiction, dealing with grief, PTSD, self-esteem, learning issues, overcoming fears, procrastination, sleep, and insomnia. Quite a range. And to help us understand hypnosis, the power of it and how it works, I'm excited today to interview Dr. Elaine Kissel. And I'd recommend getting something to write with. It's going to be a lot of information that she's going to be sharing with us today. And what I'd like to do is take a couple of minutes and share a little bit about her background. She's been doing this for a very long time, and it's very important in the world of hypnosis. So let's take a couple of minutes and then we'll get started and jump right in. Elaine was born in London, England, and received the major portion of her education there. She studied psychology, parapsychology, the mind, brain sciences, and hypnosis for many years before she became a hypnotherapist. By the early 80s, Elaine's successful practice was well established and nationally renowned. The powerful impact of her pioneering and innovative approach exceeded conventional methodology and was soon universally recognized and held in high esteem. Elaine endeavored to enhance the reputation and application of hypnosis within and outside the profession, developing her whole mind hypnotherapy process to broaden the scope of how hypnosis could be used to achieve really remarkable, unparalleled results. In 1978, the American Association of Professional Hypnologists presented her with the coveted Hypnologist of the Year award for her innovations and contributions to the arts and science of hypnosis. Her scientific study showing that blood sugar, and this is very interesting, blood sugar could be controlled by hypnosis contributed significantly to this emerging body of knowledge about the potential of hypnosis to treat mainstream health problems. Very interesting, and we'll be talking a little bit about that. She created the unique and powerfully effective weight control seminar and the mind mastery course that have changed the lives of thousands for the better. She's written 3 books, and her continuing research for more effective ways to facilitate people achieving their goals was advanced by her extraordinary intuitive abilities and commitment to excellence. So we have a great opportunity today. Her work has resulted in a library of resources, including self-development courses, distant learning materials, over 50 recorded lectures, and a variety of unique custom seminars to help people discover and actualize their potential. Elaine, welcome to today's interview.
Well, thank you for having me.
All right, very excited. I'd like to jump right in, and we're going to start with some simple questions and delve in a little bit deeper. And once again, I recommend people take some notes. And in addition to that, I'm going to ask you to share right now your website for people to find out more information about you. So what's the best website? How should they reach you?
It's kisselhypnosis.com, nice and simple.
Kisselhypnosis.com, and it's Kissel. So kisselhypnosis.com. All right, let's jump right in. What exactly is hypnosis?
Well, the word hypnosis is a heading for many altered states of consciousness. So when people think of hypnosis, they think of it as like they see in showbiz and that kind of thing. When we have to make sure that people understand the difference between entertainment hypnosis and clinical hypnosis. And there's, as you say, many altered states that come under the heading of hypnosis, and each individual will achieve, with the right guidance, the ideal altered state that facilitates the healing or the change process.
Okay, hypnosis has been around for a long time. I've been hearing about hypnosis since I was a child and the power of it. What do people need to know when they're seeking hypnosis for helping overcome problems? And I talked about some of the problems, and as you know, there's even more problems that can be treated. What do people really need to know? What should they be thinking about when they seek hypnosis?
They need to get very realistic and not looking for a magic wand or quick fix kind of thing that you get with those group hypnosis where people come into a hotel room and so on and so forth. But they need to look for someone who knows how to dig the issue up at the roots and make sure that the issues are resolved on the deepest levels of consciousness. And a lot of times that the practitioners of hypnosis don't do that. You need to make sure that the person you're seeking is qualified to make sure. Let me put it this way, because I refer to myself lately more as a psychic gardener, a very good one, very, very conscientious and diligent one. So what I do is I dig up the issue at the roots, and I make sure the ground is set so that it cannot take seed again. And then of course I plant wonderful flowers. But the thing is that unless you use hypnosis to facilitate that process and to do healing where the wounds were inflicted, it's a very superficial approach. So you want to find somebody who doesn't use a superficial approach.
What's interesting, and we'll delve deeper into this, and you mentioned a lot of people think hypnosis, and you mentioned the kind of the stage hypnotist. So I know a lot of people have a sense of the stage hypnotist, and they're going to make you also do things that you wouldn't normally do. You know, there's this perception that you work with somebody to hypnotize, you're going to be under their control, and they're going to make you do things that you aren't going to do. The realistic view of hypnosis, where would it fit in, and how does it help in terms of the process? And how realistic is this concern of people where you're going to start doing things you wouldn't normally do?
Well, it's very unlikely in a clinical setting that somebody's going to get you to do something you wouldn't ordinarily do. The stage hypnosis it must be kept separate to clinical hypnotherapy. People will volunteer to be a performer with hypnosis, and it releases inhibition, which can be very useful in many instances. But I don't support the stage hypnosis, the nightclubs, that kind of thing, because it does mislead people.
So from what I've read and what I've learned about hypnosis, it's part of the tools that you use. It's not the stage hypnosis. It's something that's really going to help people understand, work to help them understand and get kind of deep-rooted understanding and make changes. And that's where hypnosis, is that an accurate view of how you see it?
Yes, except that the hypnosis most often is used by regular practitioners as getting someone into an altered state and giving suggestions for altering behavior, attitudes, things like that. And those can have some temporary effect for many people, but most people come to me, many of them have already been in hypnosis before, and they've had some, if at all, some temporary results. So the power of suggestion is what makes hypnosis very effective, but it isn't enough to resolve issues. So that you have to, as I said before, resolve the issues that are driving that behavior. One of the things I explain to people is that all behavior is motivated. The motivation is the purpose for the behavior. And then we establish neurological pathways, which we can call cybernetic loops, for acting out that behavior automatically without giving it much thought at all, or no any thought. So we have to make sure that the motivational elements are eliminated. So you can, as you've seen people who quit smoking, for example, on their own, they interrupt those cybernetic loops, neurological pathways, don't act on them for a while. But as long as the engine that's driving that behavior, the motivational elements exist, they are drawn back to that behavior, or they substitute that behavior for something else. So quitting smoking often leads to excess eating. It depends on the issues, of course. But that's the thing is you can't just suggest to someone that they're going to not want to smoke anymore unless you also resolve the issues that drive that behavior.
And that's really where hypnosis, that's where the power of hypnosis comes in. One of the things that I've seen you talk about is something called double bind. This concept, I guess, of conflicting desires that you have. Can you talk a little bit about that and where that fits in with the whole process?
Well, the thing is that we have a conscious mind and a subconscious mind. And consciously, we have these certain ideas that are not necessarily supported on the subconscious level. And I want to point this out, actually, because this is something that I have to teach everyone. Most people blame their subconscious for their behavior, like they can't help it.
Sure.
And So the subconscious is the obedient servant. Whether or not it agrees with the master, the boss, it will most of the time cooperate. It will use a lot of methodologies to try to get the conscious mind to acknowledge the issues and work them through. But most people are not taught to listen to themselves. They're taught to listen to other people or to listen to the conscious mind. The conscious mind, I teach people, is not a good boss. They haven't learned to be a good boss, and obviously supports the negatives. And so the two minds working in conflict with each other a lot of times is what causes a lot of distress for people. We know when we're doing something that isn't good for us, but what's the reason we do those things? That's what we have to understand. It isn't just because we're getting temporary or superficial effects, like somebody, for example, who eats to calm down or to relieve themselves of boredom. Those kinds of things have to be understood. And on the subconscious level, the subconscious is attempting to bring to consciousness the real issue. But people are not taught to listen. So one of the things that hypnosis does is allows us to get in touch with the subconscious and getting to know what those issues are. What is the driving factor? But those two levels of consciousness are often vying for dominance.
It's an interesting view. One of the questions, just a simple one, I might have asked it a little earlier. You're talking about conscious versus subconscious. How would you differentiate? What's the easiest or quickest definition to have people really understand the difference between those two?
The difference is on a conscious level, about 7 bits of information are available on the conscious level. On the subconscious level, there's billions of bits of information. And so that there's a filtering system somewhere between the conscious and subconscious. And so that the whole thing is the conscious mind cannot hold what the subconscious contains. It couldn't possibly even begin to comprehend it. But within the subconscious is everything about us, physically, mentally, emotionally, and past and present, and even somewhat the future. So by learning how to access the subconscious and all of its myriad powerful resources, it can be our best friend and it can be our helper and work for us the way I think nature intended. But keep in mind, and I think one of this is the reasons, is that we were being raised in our society, we're not taught to listen to ourselves. We're taught to listen to other people. Everybody else is the authority. But the subconscious is extremely wise and very brilliant and very powerful. So learning how to access its resources gives us an amazingly wonderful way of helping us ourselves and helping others.
There's a few things I want to point out to mention. So one is the fact that we're almost trained to listen to what I describe as authority figures. You know, when you're growing up, listen to your mother, you know, listen to your teacher, listen to, you know, whatever particular authority figure that is. And that's really culturally just pushed into us with so many repeated messages that I could see you start ignoring what your own body, what your own mind's telling you, and just kind of supplant that with what other people. And then a lot of times you start getting conflicting messages from these authority figures. So that creates a whole nother level. So it makes a lot of sense to really focus and kind of overcome the challenge or the typical inclination to listen to this authority figure. And it makes a lot of sense to kind of go inward. And my understanding is the real power of hypnosis is it lets you work with a hypnotist like yourself. When you're working with a client, it really helps you get in touch and help them get in touch with this subconscious and work with it to develop in a powerful way. And I like the concept that you're saying what the goal is really to have your conscious and subconscious mind working in tandem with kind of a unified goal. Working
as a team, yes. But you have to, one of the reasons I teach mind mastery is because I tell them you're a lousy boss. You're giving your conscious the wrong kind of information, negative reinforcement. And so I teach people how to be a good boss.
Yep. It makes sense. And I can hear the conflicts that I have internally. So a conflict that I have that I assume a lot of people have is that I want to get in shape. I want to be slimmer. I want to get in shape, but boy, do I like eating, and I like to eat, and I like to eat a lot. So those are really conflicting views that we have that you need to figure out how to get them working together in such a way that will help you. Does that make sense? Is that consistent with what
Yes,
you're
but
finding?
what I think one of the things we need to address is some of the issues are very deep and very complex. It isn't just because you like eating or you like food. It's what is that food serving you? What purpose does it serve you? What do you use it for? And it could be the differences in each individual and what they're attempting to do, what food represents to them
Mm-hmm.
emotionally and so on and so forth, or historically. So we have to understand each individual, and that's where the way I work with people is to go into each individual subconscious and find out what are the motivational purpose of eating inappropriately. That's why I created the weight control seminar, to get people off the diet mentality and get in touch with what is driving them to overeat and gain weight. And no matter what they do, then how many diets they're on, it doesn't last. And sometimes, the issues are very, very painful to get in touch with for many people. So it's each individual has to be understood from that perspective. So what is driving one person's eating behavior may not be driving someone else's.
Right, that makes sense. So it's not only using the tools of hypnosis, it's really using a wide range of therapeutic tools and really helping someone understand themselves. So it sounds like just hypnotism by itself, you might be able to perform something on stage, but if you're looking to really delve deeply and work with someone, you need to know not only how to use hypnotism and how to apply it, but how to use other techniques to really bring someone out and give them an understanding of who they are.
Yes, and I teach all of my clients self-hypnosis so that they have that tool for the rest of their lives, and teach them how to use it well and support their hypnotherapeutic process with me. And it's very empowering to know that you can get in touch with your subconscious, and
Sure.
you can dialogue with your subconscious and get inside awareness and understanding and support and explanations for your behavior. And sometimes people don't want to hear what their subconscious has to say.
Sure. No, I get that. I would imagine a lot of people run or hide from what their subconscious is telling them.
Yeah, and I'll share this with you because it's a case example, and I think that's explained because when I teach people to dialogue with their subconscious, and if they tell me they're not getting any answers, well, I always say, well, is it blank? Are you just, are you being patient enough, or do you feel resistance? And then we have to find out if the resistance is conscious or subconscious. But I'll give you a case example with this gentleman that I was working with. And when he would come in for a session, have you been dialoguing with your subconscious? Yep. What are you getting? Nothing. Okay. So after a while, I just said, well, okay, while you're here, and what he referred to as the magic chair in my therapy room, I had him go into hypnosis, and I asked him to ask his subconscious the reason that he wasn't getting, the appropriate changes that he wanted. And it just was a minute, if that. And he came out of hypnosis. He said, I did not want to hear that. And his subconscious was being very, very honest with him.
Right.
And telling him, look, it's not about other people. It's about you.
Uh-huh.
You're just, not being realistic. You're
right.
not a good boss, that kind of thing.
Mm-hmm.
So it was a matter of understanding what he needed to do within himself to bring about the changes.
Okay, that's interesting. So it's in a lot of cases about finding insight about yourself. So a question that I think a lot of people have is, can I be hypnotized? Am I a good potential person to be hypnotized, and could hypnosis help me? So the broad question is, can anybody be hypnotized?
Yes, anybody can be hypnotized, but not with the same method. That's why I tailor the hypnotic approach to each individual. So many people come to me and they say, I tried hypnosis and it didn't work. And one of the reasons is they didn't actually experience hypnosis, or there might have been resistance to change, or the issues weren't resolved. But the thing is that I do an evaluation process, and I learn how the person processes the language, all kinds of things, so that I know how to formulate the induction to get them into hypnosis.
Right. So one of the things that I've seen, I think many people have seen when they think of hypnosis, is somebody kind of maybe have a watch, you're getting very sleepy, your eyes are getting very heavy. Is that ever a part of how a therapist would work, how someone would work? Is that typical, or are there other methods? What should someone typically expect? They're working with you and you're looking to get them, look, there's a couple of things, and you're looking to get them in a hypnotic state. So what would be a typical approach? What should somebody expect to see while they're working with you to get them into that state?
Well, the watch thing, that kind of the pendulum thing to hypnotize people is a bit old-fashioned. And I use language. The language is the most powerful. Words are very powerful. And I guide people based on what I understand about how they process their language systems, how quickly they integrate. I formulate the process for the individual, so it would be highly variable. But the standardized techniques of prescripted hypnosis and the standardized methodology to get people in hypnosis is very inconsistent in its effectiveness. It doesn't last, it doesn't work. And that's why so many people are disappointed in hypnosis.
Sure. So it sounds like over the years, and you've been doing this for many years, you can gain an understanding of people and see what particular technique, what approach, what it's going to take. So one of the things that I've heard, and you can either confirm it for me or deny it, is that in general, we go into an hypnotic state at different times of the day. So it's almost natural for us to be going into an hypnotic state. Let's say there might be an hypnotic state you go to right before you're falling asleep. So there's a stage in between, or there's sometimes when I'm kind of like daydreaming, or I feel like in a hypnotic state. Is it a natural thing to get into this hypnotic state for most people? And
yes, of course, it is natural. And so when people think of hypnosis, they're thinking of something like on the stage and screen, and it doesn't look natural. But it's, like I say, altered states of consciousness are part of every life. We're in and out of them all the time. The difference is, in a clinical setting, we facilitate the ideal state for each individual, and we can use hypnosis to the advantage of the individual.
All right, so that sounds where the real power comes in. You work with people to help them get into the state where you can then kind of reach the subconscious mind, work with them, and now I'm getting a picture. So you're working with them to create a situation where they now have, either through you or you're teaching them self-hypnosis, you now have access to your subconscious mind, and you're creating a situation where you have some sort of goal, and now your conscious mind and your subconscious mind, literally, as you're saying, they work together as a team to get the results.
Actually, they don't necessarily, because you can give wonderful suggestions and guidance in hypnosis, but often the conscious mind does not support that. So someone's in hypnosis for a while, and you're giving the subconscious support to bring about positive change. But when that person comes out of hypnosis, they go about their everyday life and they're not supporting that. They're contradicting it without realizing. And that's one of the reasons why I teach mind mastery. And one of the reasons for the weight seminar is so that people know how to support the hypnotherapeutic process.
So there's a lot more I want to cover, but I want to just remind people that in order to get information about Dr. Kissel and what she's doing, go to the website, and it's Kissel, Kissel, hypnosis.com. And if someone wanted to speak with you or someone wanted a session with you, there's a place on your website to sign up, put your information in, and get a session directly with Elaine to get more details on how this works and how this process. And there's a lot more I want to cover, but one of the things I want to mention, a lot of people I know have in their minds, if you're working with someone using hypnosis, you need to kind of be standing right next to them. They said with the watch in front of them. That might have been more common 30, 40 years ago, but now with the power of the internet, with the power of things like FaceTime or Skype or Zoom, you have the ability to work directly with Dr. Kissel, regardless of where you are.
Yeah, Skype, Google Duo, FaceTime, you name it. That is wonderful. And Some people will resist that because they feel that it isn't going to be workable, but there's no way I would do that if it didn't work well.
Right. All right. We've covered a lot so far. I want to delve into a number of other things. I know you've written several books. Tell us what inspired, what got you on the writing bandwagon?
Well, I started out as a writer, actually. I worked as a freelance writer in magazines, newspapers, and I was an editor for a newspaper for a year. But I was very interested in the mind and the brain and the psychic phenomena and everything else about psychology. And after I started doing that, I kind of moved into what I'm doing now. It was a long story, actually.
All right. Well, books are a very powerful way to find out about what you're doing. One of the areas that we both mentioned that hypnosis is used for is kind of weight control. And I know you have weight issues in the United States and abroad. It's a big issue, health issues and tied to weight. I know you have your weight control seminar. Can you explain what that is and why you created that?
I created it because by the time most people came to me, they tried every diet imaginable. I've even had some people who've had their stomach stapled and their jaws wide shut, things like that, but it didn't resolve the issues. And they were too diet oriented. They believed that diets were going to, but they couldn't stay on diets indefinitely. There was a struggle. So they needed to put dieting away and understand what was driving their behavior. What was going on within them that was motivating their inappropriate, and sometimes actually being overweight itself was a purpose. They needed to be overweight for some reason. There's a lot of different reasons that people overeat and gain weight, and a lot of different reasons why diets don't work. But that's why I created the weight seminar, so people would take a shift and get a whole new food in its proper context in their lives, and not use it for emotional reasons or not use it for strategies in life or whatever. And it's much more complex and challenging issue for the majority of people. That's why, and I see there's still a lot of diets out there, and when a person sticks to a diet, it's not always easy, but yes, they can lose weight. However, I've met people who have been on diets for a long time and not been able to lose weight because the subconscious won't let them. So that we have to understand what the purpose of that weight is in each case. So it's very highly individual.
What's interesting, and one of the things that I've been told multiple times is that any bad behavior, anything that's hurting you has some benefit to you as well. So if you have any behavior, you mentioned overeating, there is some benefit that you're getting out of whatever that particular behavior is. And in a lot of cases, it's a matter of being able to understand and identify what that benefit is in order to eventually overcome it. You know, we've heard the term bandied about emotional eating and things like that. And it really comes down to understanding kind of what are the root causes. And it sounds like hypnosis is one of the many tools that you use to help people identify what that is and figure out how to develop a plan to overcome it.
In the weight seminar, the process is that I guide people to get them in touch with the motivation factors and help them put food in its proper context. But people have to be realistic. You know, that it is a process.
Right.
And so many people are looking for a quick fix, you know.
Everybody wants the button to press. I get it. They want the easy button to press. They want the pill to take. They want to turn on the switch. And it's a process. It's a process. And what I like about hypnosis is it's also a process, but it's one that I've read multiple studies on, that hypnosis in conjunction with other tools and techniques just increases the effectiveness and the ability to kind of heal and make these changes. And that's really, in my sense, where the power of hypnosis comes in. It's hypnosis in combination with things that really enables you to kind of step up the effectiveness.
Exactly. And I want people, you're making a very good point, because people think they're going to come in, get some hypnosis and walk away with positive permanent changes. And that's not realistic.
All right. Well, the nice thing you mentioned earlier, not only to give them the tools and you work with them now, but you teach them how to use self-hypnosis and continue to work with themselves to continue developing. So it's almost like you kickstart them, you get them on the path, and then you give them the tools to continue on the path themselves.
Well, I stick with people enough to the point when I know they're healed,
Mm-hmm.
and they've established literally a new psychology. And the self-hypnosis is a life skill, and it can come in handy for anything in life to help you overcome a problem, or have dental work done without anesthetic, or surgery without anesthetic. All kinds of ways you can use hypnosis. I can't think of a way that I haven't employed it over 44 years of practice.
All right. I'm going to jump over to another topic, something that I mentioned earlier, and you mentioned you have something called the Mind Mastery course. Can you tell us a little bit about that?
It's fundamentally mind training. It's getting the conscious mind, as you said before, to be a good boss, to know how to deal with stress more appropriately and healthfully. Of course, that's one of the factors. To learn how to be able to dialogue with their subconscious, to learn life skills, as well as support the hypnotherapeutic process. Most people don't know how to deal with stress healthfully. They do meditate, sometimes they do relaxation techniques and so on. But again, it's what the conscious mind is the boss, and it often
Right.
gets in the way of the wisdom that lies within.
Mm-hmm.
And so it's mind training. And it evolved from my own personal experience of overcoming a 6-month prognosis, if I was lucky. And the methodology that I developed with working with my subconscious to heal myself, I turned that into the mind training course. And in and of and by itself, it makes an amazing difference in people's lives.
I like it. And just to remind folks, information about that program is also kisselhypnosis.com, so you can get details there. Another area that I want to talk about, and I mentioned this, and it's very, very interesting to me, blood sugar. So people don't realize high sugar levels, there's so many issues, diabetes, there's so many issues tied to that. And my understanding is you were able to demonstrate and prove that blood sugar can be controlled with hypnosis. Is that accurate? And tell us a little bit about that.
Absolutely accurate. I did a scientific study with it, and proved that with hypnosis, you can control blood sugar. But I don't want to just linger on that basically, because what this does, it proves that hypnosis enables us to bring about changes in the body. And so we can use it for healing. I work with cancer patients. I work with people with all kinds of pain and so on. I've helped people undergo surgery without anesthetic. The mind-body relationship is what people need to understand. And that's one of the things that I teach in Mind Mastery. And when I'm working with people privately in hypnosis, I teach them about the mind-body relationship. The body, in many respects, is like a mirror of the mind. You can prove that with biofeedback.
Right.
You can't even complete a thought before it's manifested or mirrored in the body. So it's very important to understand that and work with that, the power of the mind, to influence the body in positive ways, not just negative ways, and which, of course, it does inadvertently. Yes.
So it's a broader than just blood sugar. And what's interesting is I'm a strong believer in the power of the mind to work in conjunction with the body to heal itself. So I'm a strong believer in attitudes and a wide range of techniques, if applied correctly, enables your body to release its healing power. But on the flip side, it could also cause disease, anxiety. On the flip side, as much as there's healing capability, is also destructive capability. And it's,
well, yes, and I think that one of the things that we need to understand is many illnesses are symbolic references for what is going on within a person emotionally, or what's going on stress-wise. So the body becomes the messenger or the expression. So very often the symptoms that a person is experiencing is a symbolic reference to what's going on emotionally.
right.
So by, again, using hypnosis and working with the subconscious to get inside awareness and understanding enables us what we need to do to get that person to bring about healing and change.
Okay. We've covered a lot of things today. I have a few more things I want to go over. Do you have a piece of advice for everybody who's listening today? We've been talking about a lot of issues and covering conscious, subconscious, a lot of different things. a piece of advice for everybody who's here.
Well, okay, the advice would be that the more you learn about your subconscious and your relationship with your conscious mind and that relationship, and learn how to work with them better, your life is going to be better. So I would always recommend learn about that relationship, make that relationship much more healthy and appropriate, and then a lot of healing can happen.
Okay, I like that concept. A couple of other things I want to touch on. So you talked about this whole mind hypnotherapy. Can you talk a little bit about what that is and why you created that? How does that fit in?
Well, because the notion that hypnosis is you're just only working with the subconscious, and a lot of hypnotists just do that. They get people into hypnosis, give them suggestions, and keep their fingers crossed that's going to work.
Right.
Whereas I work with the conscious mind and the subconscious mind at the same time. And as I said before, I teach the conscious mind how to support the hypnotherapeutic process. I help the conscious mind understand how it has contributed to the problems and how it can make changes. So I work with the whole mind. It isn't just getting someone in hypnosis and giving them suggestions to change. It is teaching the conscious mind how to support the hypnotherapeutic process, how it can help facilitate change.
All right, sounds good. So for people who are interested in working with you, you've covered a lot today. Obviously, when you're working with people, you're applying a lot of the techniques, a lot of the things you're talking about today. And I want people to walk away with a few messages and a few things to understand. One, hypnosis isn't some scary thing where someone's going to take control of your mind. That's not what it's about. It's about enabling you to tap into your subconscious and working with you, and also in a process where you're working with both your subconscious and your conscious mind, and developing techniques and ability to make the changes in your life you want to make. So anybody who had the perception that hypnosis is a scary thing, it's a very effective technique. Multiple studies have been done about the power of hypnosis, not only by itself, but in conjunction with how Elaine does it, with a number of other techniques. And she's clearly, you've been doing it for a very long time. For someone who wants to work with you, I just want to give out the website one more time. I've now given it out a couple of times. And once they get to the website, should they call you? What should they do should they request a consultation? What should they do when they go? And it's kisselhypnosis.com. What should they do when they get there?
Well, they've got the phone number there, and there's ways that they can contact us there to schedule an appointment. I always do an intensive evaluation before I make a recommendation, and before a person prescribe a program of hypnotherapy and tell them what it consists of, what it costs, and then it's entirely up to them. Everything's upfront. There's no obligation, but people need to be very realistic about this, because this is not, it is, as I said, it's a process of change.
All right. Any idea who would be the ideal person that should come to you? What situation of someone saying, I'm in a particular situation, who would be ideal person for you to work with?
The person who's realistic in their expectations and are ready to learn what they need to know about hypnosis and hypnotherapy, and what it's going to take for that individual to make permanent positive change.
Okay, I like it. We're just about ready to wrap up. Everybody knows how to get in touch with you. Any final message for people about hypnosis, where it fits in the power?
We just know that it's natural, and when it's used appropriately, it's a powerful healing and change process that there's nothing, I think, that could possibly match it.
All right. Thank you very much. We covered a lot of very powerful information. And I recommend everybody do two things. One, at a minimum, go through your notes. Hopefully you took some notes and gained a better understanding where hypnosis fits in. Look into it. It's a serious option, an effective option for a wide range of issues and challenges. And if you're looking for somebody to work with, Elaine clearly knows what she's doing. She's had a great success record. Follow up with her, contact her. She'll step you through what's involved with it. And I want to thank everybody for listening. Thank you for being here today. And I wish everybody great success with everything they're doing. We'll talk to everybody soon.